Welcome to Metabolic Matters Podcast, where we embark on conversations with thought leaders, disruptors, change agents, and passionate souls. Together, we'll delve into what truly matters to them. And you'll learn how to metabolize this newfound wisdom so you can transform your own metabolic health. Now let's meet today's guest.
I almost feel a little emotional having you here because this woman that is before me today and before all of you today, first I get to proudly call her Dr. Kayla Osterhoff because I've known you to be in the trenches of getting your PhD for some time now. So it's so much fun to be able to walk across that threshold with you and be one of the first to celebrate that new iteration of your life. But everybody, you are in for a treat today because this woman is stinking brilliant in her intellect, but she's also on fire with her spirit and her soul. And the two of us, this is what I love about the 6 degrees of separation and whatnot, that when people come together in very unique ways, other people brought our paths together and we didn't know each other just a couple years ago. And yet out of that, even though those other people are still very near and dear people in our lives and our hearts in other ways, at the end of the day, the glue that stuck and maintained a deep bond and a deep ongoing continuity and kind of plan for the future, Dr. Kayla and I are here on that journey still together, really linking arms and ideas and hearts and philosophies and hope and inspiration for the future. And so welcome, Dr. Kayla.
Thank you. Thank you so much for having me. And something came to mind as you were explaining our path and journey together, which I think we've been together for 5 years now. And that was basically my entire PhD journey, which was about 6 years. So you knew me through all those iterations. And I heard a saying that people come into your lifetime for a reason, a season, or a lifetime. And you're definitely one of my lifetime sisters. So I'm so grateful that we are connected and get to work together and fulfill our purposes, linking arms.
Big time. And it just gives me chills. And there's so many things. There's so many things where we came together kind of on a professional level. And then we also morphed our lives into, I got to bring some of my expertise into your world in a very personal level. And you've gotten to bring some of your expertise into my world. And now we're bringing our expertise together in a whole nother world that we'll get to later, potentially on some level of what's coming in the future. But one of the coolest things of how we came together was talking about this, and you talk about this on your websites and other places, this closing the gap in health science. And specifically because your passion is on the path of the feminine, however that is manifested, and whether it's gender specific or not, but beyond that level, the sort of divine feminine and whatever level, is to demystify that concept and specifically demystify the feminine biology through the process of good science. And before I break down like the areas that you and I have uncovered together of where you actually uncovered it, and I just kind of came along for the ride as you taught me of the areas of disparities in this arena. But your actual title as Dr. Kayla Osterhoff is neuropsychophysiologist. Before I go into those disparities, will you please define that mouthful of
neuropsychophysiology is essentially the field that brings together neurology, psychology, and physiology. So essentially what it is the study of mind-body medicine, or the study of how the mind, the brain, and the body all interact. These 3 systems interact together to create the human experience.
And this is where talk about, so even each of those, even in that mouthful, those 3 distinct things she talked about, that's actually how they're presented into the world, are these 3 distinct silos, and nary the 3 shall meet. And so where some of these places that she sparked curiosity in me and understanding deeper in me is, I recognize this, but she gave it the language, and she gave it the research, and she gave it the sort of meat to this, which are some of the limitations, which involve things very simply, like getting to the most sort of, I guess, macroscopic of just this underrepresentation
Yeah.
of females in clinical trials, and also just even the structure of our clinical trials and their deficits, the assumption that there is an absolute biological similarity between the feminine and the masculine counterparts.
Yeah.
There's just also this limited focus on reproductive health in general, both for men and women, honestly, but in particular for women. There's this place why part, and she'll, I'm sure, talk about this on some level, that women kind of get shoved to the back because of our hormonal and menstrual cycle variability. We're sort of unpredictable in some eyes. The psychological and sociocultural factors, the lack of gender-specific biomarkers, the stigma and cultural biases, and this whole intersectionality. So any one of those you want to pick up and unpack a little bit further?
Ooh.
6 years of your life in a nutshell.
Yeah. Well, the thing that has really impacted me and kind of set me on the path of my journey, and I know has impacted you in your journey from the time you learned that you had cancer and through your entire process with all of that, and then even getting your medical degree and now working deeply within health systems, you understand as well. And it's really the experience of every single woman that I know, and very deeply the experience of the women within my family. And it has to do with something that is a term that's kind of being out there in the ether now. It's getting popularity, which is gaslighting.
Oh,
And
wow.
medical gaslighting specifically, but really we're talking about cultural gaslighting that women are experiencing exclusively in the way that we experience it. And what it looks like within my family, I'll give you an example. The women within my family really struggle with mental health issues, including addiction, depression, anxiety, suicide, really you name it. And the women within my family deeply experience these things. And so as a child, and even before that with my mother's experience, I saw women struggling to understand themselves, understand their bodies, and understand how to take care of themselves while also trying to take care of the family and the community and everything else that they have to take care of. And so there's this confusion amongst the women within my family and amongst the women in our society of, who am I really? How does my body work? What do I need to do in order to take care of my body? And how can I take care of my body and also take care of my responsibilities as a mother, as a community leader, as the glue in the family, as, working in the workforce, or all of the things that women now do, right? And have done for millennia. And so, the way that this kind of transpired within my family unit was that my mom had lost her mother to suicide when she was 12, about 12, 13. And when that happened, obviously it's a significant trauma. And my mom, her trauma response to that and some other traumas that happened along the way, was to get tougher and just push through. Now, just push through is a story that women use all the time. How many times have any of the women listening to this said during their menstrual cycle, during menstruation, when they feel like, maybe they don't have as much energy as usual, or they might be dealing with some kind of menstrual symptoms, and maybe they're having a little bit of brain fog, and they still hold themselves to this really high bar of being able to perform like Superwoman, right? And so what they say is, I'll just push through. Mostly because we don't really understand what's going on in our bodies and that the needs are really changing, and how to take care of ourselves. So my mom never learned how to take care of herself. She just put on her armor and she went out there as Superwoman, and she did a really amazing job. Like, she raised 4 of us kids, had 3 jobs sometimes at a time. We were a very kind of low income family. And so my mom really had to work really hard in order to maintain our family unit. And then also she was the primary one to deal with all the kids, right, in the family unit. So she was taking care of everything at home. She was working 1, 2, or 3 jobs at any time, and really making sure that all of us kids were taken care of, that we had food, clothes, and that we were okay, right? And she did a really
Nope.
good
Yeah.
and she was known by my friends to be like the strictest mom. They were like, "Oh, we don't want to come over to your house because your mom's too strict." Because my mom was very crack the whip. You know, you come home, first thing you do are your chores. Second thing you do are your homework. If it's still light outside, then you can go outside and play. And these were just kind of the way that she ran the family. Very tight ship she ran. Um, and then her purpose being us kids and raising us kids, because that was all she knew, right? As we all grew older and started to leave the nest, well, things started to fall apart for my mom, because she was then having to look into herself and also experiencing all these crazy symptoms of health issues that she had no understanding of. And every single doctor that she went to, all they would prescribe is 2 things. They would give pain medication and they would give antidepressants. And of course, so she's popping her pain meds and her antidepressants, and she's like, what the hell? I don't feel any better. This is all I know to do, because she has no understanding of her body. She has no understanding of what's going on with her. She really doesn't have an understanding that she's even traumatized at this point. And so she's taking all of her pills as prescribed, and that turns into a full-blown addiction. So fast forward from that to my junior year of undergrad. And my mom had 3 overdoses that year. And that was when I discovered she was so high functioning and really good at hiding it. I didn't even know she had an addiction. So I found out the first time when she had an overdose and almost died. And when I went to the hospital, the doctors were saying, what did she take? What did she take? And I'm like, nothing. What are you talking about? Like, I have no clue what you're talking about. Like, help me. My mom's dying. We don't know why. Tell me what's going on. So found out she had a full-blown, like, very significant opioid addiction. That same year, she overdosed 3 times and landed in the hospital each time, had a stroke, has significant brain damage from it. Luckily, she is alive and well to this day. Whew. But that was a huge wake-up call for me, because at that point, I was on a track to become a physical therapist, and I was going to go to physical therapy school. I was working in a physical therapy clinic. And when that happened, I put the brakes on everything and I said, no, something is seriously wrong with our health system. And something is seriously wrong for women within our health system. Because even in the clinical setting, the patients that I was working with in the orthopedic clinic, the men had significantly better outcomes than the women. Time after time. It was just repeating. And then now I'm going through this experience with my mom and dealing with these doctors and what are the options to deal with addiction. Well, they're not very good. I'll tell you that. And for women, it's a total shit show. Like, nobody knows what they're doing out there. And they're just putting women through these protocols that are designed for men, which we can get into later. So, so anyway, that was my wake-up call. So at that point, I pivoted. I went full into public health, and my goal was to work at CDC, because that was the one, that was the highest level I could go in terms of having an impact and understanding the health system and really dealing with this opioid crisis and figuring out what are all these underpinnings within. So got my master's in public health, got the job at CDC, moved across the country to Atlanta, and started working at CDC. And when I got there, I realized very quickly that it was a very male-centric and competitive environment, because I was a health scientist. So working in the science, it happens to be a lot of men, though there are a lot of women working at CDC. I would say more than probably any other government agency. But it was extremely competitive and very, the culture was very male centric and very much cultured around burnout. And what I found out quickly with my own health is that all of the things that I knew how to take care of myself, even with an undergraduate degree in health ecology, a master's degree in public health and epidemiology. Everything I had learned up to that point, these tools weren't working, and my health started to deteriorate. Even though I was eating perfectly, I was exercising, I was meditating, I was doing all of the things, but none of them were working, and my hormones started to deteriorate. And to the point where, when I eventually had gotten my hormones tested with a functional doctor, so I kind of left behind the traditional health system because there were no answers there for me, went into functional medicine, got a whole gamut of labs, and found out that I had the hormones of a 90-year-old woman. I was shocked by that. And what I was more shocked by was that even my functional medicine doctor had no plan and no real education on how to get me back to a place of balance, and really couldn't describe or show me how to take care of my female health and biology. So that's where I branched off and went on my own journey of studying, and then eventually got into the PhD program and focused specifically on women's neuropsychophysiology. And from there, and also working at CDC through the majority of this time, I clearly saw behind the curtain of our health systems to see that women are completely disregarded and left behind and just lumped in with men. And that's because the data that we have is on men, male bodies, and male centric. Yeah.
And I want to be clear, because if anybody's just tuning in right now or doesn't know you, I hear this when I've seen discussions around disparities in women's health, men's health. A lot of people jump on this, oh, you're just a male basher, man hater, you're really dissing on the patriarchy. This is so not who you are, what you are about. In fact, you're probably one of the most loving, and you love that divine masculine, you made me into this beautiful. How do you respond when someone inevitably thinks you're a man hater?
So my fallback on everything, anybody who doesn't like my position or doesn't like what I have to say, my fallback is data and research, because that's a language I speak. And so when you present the data and the statistics and the research, it's not about bias. It just is what it is. The facts are what the facts are. And the facts are that women have not been and still are not included in our scientific inquiry, not only in the United States, but across the globe. And the reason being is because of our biological complexity caused by the ebb and flow of our hormones that is very different than our male counterparts. Those are just the facts. Yeah. Men are biologically less complex. They are more consistent. They are amazing research subjects. If I wasn't studying women, I would exclusively study men too, because it's so much easier. It's straightforward. It's cheaper. It takes less time. You can literally study men and take a point in time measurement. With women, you absolutely can never do that. You have to take measurements over an entire month-long cycle, and then over several cycles, at least 3. Now you took your research budget and you blew it up by probably 800% just to study women on the same subject.
And the other part about women, is for the most part, comparatively, so you talk about our biological shifting kind of month to month or even day to day, but we also have seasons of our life, so that concept of where we are pre-menarche to, the sort of like the spring moving into our first menstrual cycle to movement into the summer of our fertility, the fruiting of our fertility into that phase, into the fall of our transitional perimenopausal window, and moving into the winter of our menopausal window. Those are true, very specific seasons, which also, expand beyond what our male counterparts have. And so, or complements have, I should say.
Yeah.
And so there's that isn't even we even lump in, because one of the projects you and I did was you still represent a group of the sort of the spring summer, where I was, at the time we met, was representing sort of the fall winter, and now I'm winter. How fun. And so it's just yeah, isn't it fun? And so it's just an interesting window here, because what you were bringing to the table, I could speak to what it was like to embody that experience and hear from my peers and my colleagues, and and also remembering where it was in all those previous seasons, if you will. And so building it up, that there's even disparities among the seasons, because we are very, very much wanting to create and preserve like forever summers for every
Yeah.
single woman. So can you speak to that? Because I think that's another place where we are causing serious harm to the female. Yeah.
Well, let's shift over the focus to something that more people will understand. Let's look at the corporate space or corporate America, right? Or the workforce. Let's just call it the workforce, right? Within our workforce that we all participate in as humans, there are men and women, right? There are more men or more women in the workforce now than there has ever been, and we're getting closer and closer to about 50%. And in some industries, we're there. Some industries, we're still a little bit less. Now, where the disparities come into play is when we get up into leadership, it's still very male centric in terms of there's a lot more men in leadership positions, business owners, these higher positions than there are women in those. And it's something that has been gaining a lot of media attention across the globe as a problem, because we understand that we want women to be able to excel and move into the leadership positions that they are working towards, just like their male counterparts. We can all agree that we want that. However, it's not happening. So there's some reasons for that. But when we look at those differences in the seasons of life within our workforce only, I'm just giving one example, and there are 100 other examples of this, we see that there is no real ageism or discrepancy for men, whether they are 30, 50, 60, 75, whatever, right? There's no term for them in different ages. Now, with women, we have premenopausal and postmenopausal. And those are true labels of two parts of our experience. And in the workforce, especially in the leadership, you're going to be almost 100% the menopausal ladies, right?
Interesting.
And then in our workforce, you're going to have about equal of the premenopausal and the postmenopausal women in that workforce. Now, walk into your workplace and try to spark up a conversation about menopause. See what happens.
Because menopause, people who don't get it yet, they're not crossing that bridge.
No. Menopause is a dirty word. So is menstrual cycle. Try having a conversation about your menstrual cycle to your boss, especially if it's a man, and see what happens, right? So, and it's not because of bias. I truly don't believe it's because of bias. Of course, bias exists, but there's a bigger problem. It's a lack of education. It's a lack of understanding. Women don't understand their own bodies. Corporations don't understand women's bodies. Our medical system doesn't understand women's bodies. Doctors don't understand women's bodies. Researchers don't understand women's bodies. And nobody's really trying to figure this out. And it's a huge, huge, huge problem. And it plays into why we get to this place where we can't even talk, we can't even say a word that accurately describes our experience as women in the workplace.
Interesting. Super interesting. And, and so what a good example. I mean, that's very new information for me to think about that, and think about too, like the cycles or the seasons of life of even women in leadership to women not in leadership, of how do we create good communication, understanding of each other's beings in that space, as well as bringing the men up to speed as to what's going on in all these seasons as well. Yeah. But I would love to, I do this one. I'm going to kind of hold your feet to the fire to come back to this one, because now that I've crossed that threshold into the winter season, there's also this thing I see, like I was just at a huge, and this is it's not a judgment, it's an observation. So I just went to A4M, which is like the Super Bowl of integrative medicine out there. And I mean, there were thousands and thousands of people in attendance. And what I'm seeing is like the theme of this year was longevity, but really it's not longevity, it's anti-aging. And even more specific to that, it's how do we make this container to the outside world look like it's not, that we're still in our summer, perpetual. Yeah. And so when our focus is on this very external experience and witnessing of that, there is still what I witnessed in that, and I know, believe me, because I met people who are going under the hood and looking deeper. But
Yeah.
the majority of people, even in my field, are very concerned about the external and about the perpetual summer preservation than they are about the natural seasons of support, of thriving in whatever season you have arrived in.
Mm-hmm.
Can you speak to that a little bit, and what might be happening in terms of changing the ability to be truly optimal when we are fighting against nature's process?
Well, I think that that is an unwarranted distraction, and it's causing further confusion, especially for women, because instead of just trying to understand our basic biology and this hormonal shift that no matter how much biohacking stuff you do, you're going to go through perimenopause and menopause at some point, and your hormones are going to shift. Do you understand what that process is going to be like and how to really support yourself through that process? Or are you burying your head in the sand and saying, I'm not going to let that process happen, because that's not possible? So to me, it's a distraction from what we should be focusing on. And we have to back way, way, way up with women. And that's exactly to your point of, it's not men versus women. It's coming to a place of equality. And so just naturally, because of how much data we have, men are here in terms of health, healthcare, understanding their bodies. I'm sure we still have plenty of ways to go, but women are way, way down here. So we have to do the work to bring it here first, and then we can both go up and we can optimize from there. But we can't optimize from a system that we absolutely don't even understand how to support, just to maintain basic health and basic function. Yeah. So what I would love to see at a conference like that is a discussion around how can we close the gender gap within our health research. Even in these studies that we're looking at, like telomere length and all of those things, right? So even in those studies, we're still not appropriately studying women. So what I mean by that is, just take a look, go to PubMed and look for any research, especially one that you remember that there were women included. Right. So then it has to pass the test of these checkpoints to know if it appropriately included women and if the results are actually accurate and applicable to women. So first checkpoint is, how many participants were male and female, right? Already you're going to lose the vast majority, because the vast majority are going to be exclusively or mostly men. And the reason being is because they're cheaper, easier to study, all of that stuff, right? So it makes logical sense. So now we got the grouping of studies, the handful we have here, that equally included men and women, or were exclusively women, right? Okay, that's great. But now we've got to dig a little bit deeper to understand if they did it right. Now, we have to look at how they collected the data. Did they collect the data through all 4 significant hormonal checkpoints if the women are within the active menstrual cycle? So that means that they have to either be collecting data on whatever they're doing every single day through an entire cycle. And in addition to that, we have to at least look, did you only study 1 cycle? Already, results are irrelevant. You have to study at least 3 cycles. So you're looking at least a 3-month study. My dissertation, I studied women's neurophysiological biometrics across the female hormone cycle. And I had to run the study for 4 months. All of my colleagues, all of my PhD colleagues within my school finished their data collection within a week. Mine went 4 months. Wow. I did that to myself because I refuse to contribute negatively to this gender gap. So did they collect the data correctly? So you got to look at how many cycles. You also have to look at how did they calculate the cycle phases? How are they accurately determining what are the phases of the cycle? When does one phase start and one phase end? And then also, what is the length of the full cycle? Again, going to biological complexity, every woman's cycle is like a unique fingerprint. It's totally different.
Thank you for
that.
that.
Not only that, we can have different cycles every single month. So 1 month could be 30 days, 1 month could be 28 days, the next month could be 36 days, right? So we have to be measuring accurately and have a lot of touch points with these participants. I had to speak with my participants almost daily, all of them, the
Amazing.
whole cohort. That's the level that it's going to take. Super expensive, super labor intensive. Okay, so did they do that?
World.
Yeah. So that's your next checkpoint. Did they do that? So now you've lost a whole bunch of those studies and you've got like a little handful of studies left. Okay. So now you got the really juicy ones. Yay. Okay. So now with that little handful of studies, now you look, did they report the findings by menstrual cycle phase?
Wow.
Right?
And they're
So
like, goodbye, the rest of you studies.
now we've pretty much lost all the studies and we have about 0.0001%.
No wonder.
So it's a real problem. And this goes into how we are treating women when we get into the actual clinical setting, right? In the clinical setting, we are using protocols that are based on the data that we have collected. The data that we have collected is almost exclusively male centric and does not apply one-to-one to women. Now, we might get lucky occasionally, and some of that data does apply, but the majority of the time it does not. And we're seeing example of this, especially in areas of chronic disease like heart disease, autoimmune disorder, all of these things. The way you treat women has to be different. And if the doctors of the future, that's what I'm going to say, because I have this vision for the future. The doctors of the future will deeply understand female biology, will actually be taught full course lines of female biology, which right now there is not even a single course offered in female biology in any medical school in the United States or anywhere else. So there's reproductive health, right? But that's not female health and biology. So anyway, so the doctors of the future will, first of all, when any woman comes in, will understand the female biology and physiology in a way that they currently do not. They will start to take measurements on that. That will be the first frontline intervention and information that they have to collect is understanding the status of this woman's menstrual cycle and hormone status, whether she be actively cycling or post menopause cycling, because there's still there's still many key differences in the female biology, whether it's post-menopause or premenopause versus male biology. And then what they will do is they will prescribe and treat, changing the doses and aligning the treatment with each menstrual cycle phase, understanding that there are such differences in the physiology that you have to change the treatment across the cycle.
Oh my gosh.
So that's what we're missing.
And here's where I just feel like kind of a recap of like the dream, the how it should be is, first of all, I just want the listeners to understand that, like, for instance, we give thyroid medication to replace thyroid function when it's not working well. And yet the reality of the physiology of that is that never, ever, ever is your thyroid on like autopilot, which is how we medicate it, right? It should be blipping around and up and down, different things, right? Well, that's just thyroid. But when you look into the female hormones, the same thing is where we're putting people on, say, birth control or exogenous hormones for whatever reason.
Yes.
To either invoke pregnancy or to help with perimenopausal symptoms. We are doing the same thing of like expecting that you will be the same level all the way through, which also is inherently not natural and goes against this internal, like there's a process that's happening. And so there will come a time and a place when we look at the variables that you talked about, the millions of touch points and metrics that we can measure, even the epigenetics, the single nucleotide polymorphisms of how your hormones metabolize. And then we can even look at your metabolites, like, okay, well, what things from the external environment and things you're putting in, on, and around you are changing how your liver is functioning, for instance, phase 1 and phase 2 detox pathways, that medication that might have done one thing the day before is doing something entirely different the day after. Why the F do we have anybody on any pharmaceuticals of any kind? Because this lies the problem that none of us are meant to be a constant, and our body's always working so hard in this homeostatic process, but add a layer of the feminine to this, the female psycho neurophysiology to this dynamic, and you've got a whole nother wily coyote to work with here. So what is showing us is that we are so far from this. Like she said, we are buried. We're like underground. We don't even have a sprout coming up yet. And Kayla is bringing us, she's like planted the seed in the last, 7 years of her time at CDC, 6 years in her, or 5 years in her PhD program. Now her doctorate is here. Now the real work begins, in some ways. But it's like, that's just it, is what now you've just shared a very complex thing, but we're going to throw another curveball at the group.
Yeah.
All right. Because here it is, you can go, wow, look at this in the healthcare system. This is what needs to happen. And you get excited about what Kayla's describing and how maybe that'll spill out into education. But because of your experience being in the belly of the beast, in an organization at the highest level of interface of policy, systems, education, politics, financials, research, all the things, you recognize that just coming in and getting women's physiology figured out and educating them and saying this is how you should be treated is still the tip of the iceberg of what needs to happen. Can you tell us where we're going with this?
The lack of understanding of women's biology. So if we just want to call the problem that, obviously it's a much more complex and a much deeper problem than that. But if we would just want to make it like a basic thing, a global lack of understanding female biology, understanding female bodies and what to do with them in order to keep them healthy. Mm-hmm. So nobody has the answers on this because we just have not figured it out, and we haven't done the research to figure it out. And we certainly don't have the education to teach how to figure it out, right? Yep. So we'll call it that problem. But that problem is an economic problem at the end of the day. It's a global economic issue. And because it has a downstream effect that negatively affects every single person on this entire globe, because we have half of the population who is confused about who they are, about what their body needs in order to function properly, is sick, is being gaslit on many levels, and is literally just like trying to scrape anything together that they can in order to figure it out so that they can just function in this society. What we're seeing across the globe, and this has been gaining global attention in the last 5 years, and it's becoming a huge economic crisis, is that women are exiting the workforce at mass. And it's not just in the United States, it's in every single country. So then when we had COVID experience, this perpetuated this on steroids. Right. And now since 2020, we have been perpetually experiencing the global mass exodus of women from the workforce, and it is not coming back. Even though everything is back open, men have come back into the workforce comparatively, and women are not re-entering the workforce. It's a big, big problem. And the reason why is because women inherently know that the structures and the systems, the environment, the infrastructure, the policies don't match their needs. And that's because of the root problem that we were talking about. That has to feed in to create inclusive, appropriate policies, inclusive, appropriate systems, corporate structures, workplaces, work culture, environments, infrastructures of cities, all of these things, right? So women automatically, just as being born as a woman, we have an uphill battle not only to figure out our bodies and how they work and try to do our best to scrape together the bits and pieces that we can figure out, but we also have to go and perform in an environment that is not designed for us and in harmony with our bodies and our needs whatsoever.
Wow.
So it really is a difficult path that I think gets poo-pooed a little too much. And it has nothing to do with feminism. It has nothing to do with us versus them. It has to do with people having an opportunity in order to succeed and be healthy. Every human should have that opportunity.
Absolutely. You're talking about equity and equality. And equity is about getting you up to the same place to even have a starting point together.
Yes.
Equality is about what's happening above that. Necessities have been met, and then we go. And this is what we're so like what's happened in the last few years. Like you said, it was already picking up momentum, but the last few years really shined a light on the underbelly, the vulnerabilities of this, and the burnout, the suicide rates, the explosion of cancers and autoimmunity and all things. Our genetics, our biology is no longer matching the fabricated environment of our times, be it at the home front, the planetary front, the corporate front, wherever. We're going against literally nature. And so that has consequences, and it's not a debate. It's a reality of here. And that's what's really difficult. And when you start to think about it, you start to look at, well, what's going to have to change. And so when you think about, for you, when you have your dream world, what might that like take us now? Now we've kind of like, you've exposed a lot of the deficits, and probably, I mean, I learned a bunch of things you shared today that I never even heard before. And I've been working with you for 5 years, and I feel like you've taught me so much, but I'm sure a lot of people are just sitting there going, whoa, never thought about this before. But it also means, because of who you are, your brain and your resilience, because of experiences in your life and what you've seen and what you're a keen observer of, you also have some really beautiful visions and some really good solutions to look at. Tell us about what that might look like for you and for all of us.
Well, my visions, like you said, are go beyond all of the issues and problems that we talked about. And we can talk about the issues and problems ad nauseum. What I'm really excited to do is look at the dream and also know that it's completely possible. We just have to pave a path to get there. My dream is that we have a world and a humanity and a culture across the globe that translates through all cultures across the globe, where every person who is born onto this earth has an opportunity to be healthy and fulfilled. So where I think we have a major problem that translates to men, women, and any other transgender and any other identification of human, is that we have a whole population of humanity that is confused about who they are.
Yes, and then some.
And we talked about why that's the case for women, but it's also the case for men on a different level. And it's because of our cultural conditioning. It's because of the priorities that we have been focused on. And the priority that we have been focused on globally since the Industrial Revolution, really since agriculture, the boom of agriculture, is productivity. And now the only thing that we value on this planet as humans is productivity. That's number one. That has become our number one priority. And here's the problem with that when it comes to men versus women as well. That's really interesting. Productivity aligns really well and is a neurobiological gift of the masculine, of men, of the male biology.
Wow.
And that's because men are designed on a 24-hour repeating system that is consistent and repeats every single day. Our world and a society of productivity, the corporate space, all our global economy is set up on a repeating 24-hour system, right? Where the work is essentially the same day in and day out, and the expectations are the same day in and day out. But not only that, The male neurology is also designed really well for productivity, and that's because it is dopamine driven. So the male brain is kind of harmonized by dopamine. I call it the male master neuroregulator. For women, it's something else, and we'll get to that in a minute. But dopamine being the master neuroregulator for men, that also has a harmony relationship, if in the right balance, with testosterone, which is their main neurochemical that it is a neurochemical, but biochemical that is regulating everything in the male condition. Dopamine is triggered by things like achievement, checking things off of the to-do list, productivity, right? So being productive or having a focus on productivity is really well aligned. Now I'm going to get even one step further, which is a little bit esoteric, but it's still fully factual. Even when we come down to our reproductive roles as men and women, men's bodies produce. Women's bodies do something else. They create.
Receive and create.
Right?
Yeah.
So now we look at what is the gift,
Wow.
and it's not that men and women don't have these qualities. Everyone has these qualities. But what is the natural gift of each when we're talking about a neuropsychophysiological perspective? So for women, the gift is creativity or creation.
Beautiful.
And this is not a linear process. Creativity ebbs and flows, just like our cycles in our bodies. And the women's bodies are set to a 28-day-ish, all women are different, right? Cycle that completely ebbs and flows through 4 different phases, all the way throughout, where there are neurological, metabolic, and physiological benefits and gifts that happen in all 4 phases, and then also in each of the life phases as well. So it's not a linear path. It's up and down, it's sideways, it's frontways. It doesn't look linear.
Yeah.
And then when we go into the brain, the master neurochemical for women that regulates everything else that we talked about for men and with estrogen and progesterone is oxytocin. And this is the hormone that is all about connection. People call it the love or the cuddle hormone, but that's not fully accurate. It's about connection. And women happen to be about connection, connecting their communities together, connecting their families together. In their leadership roles, they're typically involved in connectivity of the organization, right? Because it's a natural role that we play. And then when it comes to our reproductive role, we create humans within our womb, right? So, but creativity is not it's not a priority on our globe. And so again, women are starting the race a little behind because their gift that they're born with, that is stronger and natural within them, is not something that is valued across the globe.
Exactly. And I really want to just put a pin in that moment about creativity, about birthing or, growing a human inside of you. There's still plenty of women who do not grow with little humans inside of them for a variety of reasons, myself included, but my creativity is vast. And so that's the place, is whether you're creating a little human or something else that brings you fulfillment, as you said, and joy and health and vitality, which we all are inherently entitled to, right? And should have access to just with ease. That is what I think I want to just highlight, that's what you're alluding to say, that, the whole point is to give birth and move forward. It's bigger than that. Yeah.
That's just kind of the esoteric view. But I'll give another nugget about creativity and the female brain specifically. And it's a quality that the female brain has exclusively. It's not the same with the male brain. And that is that the female brain has a global connectivity system, meaning that the connectivity between brain hemispheres and also between all the brain regions is much more complex and stronger in the female brain. So what does that translate to? It translates to bigger picture, creative, out of the box thinking. And again, it's not an exclusive female quality that men don't have, but it's something that women naturally, inherently have and tap into just naturally. They don't have to try. That's just going to be their natural view.
Or default is to that place. And my understanding to take it further is also the ability that I've seen a lot of the research about women's ability to multitask in a much more interesting, for lack of a better word, productive way, efficient way, or way here than than the men's brains that are more in that linear and compartmentalized way. So is there anything to add to that nugget as well? Or is that kind of an expansion of what you just shared of the neural networking systems thinking?
Yeah, so that is responsible for that piece because it's about how all the brain regions can work globally together in a easy way. So even when you look at, there's some really interesting things. I mean, I could go on about the female brain for just days because it's so fascinating. And some of the research that is now coming out, thank goodness, is just blowing my mind and makes so much sense as my experience as a woman. So one of them is even in how babies, so we're talking about male and female babies, as they are developing with their language skills and with their the way that they communicate and understand things in the world, male babies absolutely depend on objects in space in order to develop their position and their perception of the world.
Wow.
Female babies rely heavily on facial recognition.
First, a funny little moment. My husband literally does not read a room and cannot read. He has this aphasia of seeing faces. And I crack up because it is my superpower. I may forget everything else about somebody. I always remember a face. Even somebody who's sitting on an airplane, if I run into them somewhere else that I've never even talked to them, I remember. And so I'm laughing about this moment of that. And I cannot pack a dishwasher or a car to save my life. Of the space.
Me neither.
And so I'm just cracking up. People can probably relate to these differences within their own lives and experiences.
Oh, absolutely. So even as adults, what's interesting about that, even as adults, men are more connected to objects in space and women are more connected to facial expression and recognition, which also is related to emotional intelligence and the differences between how women process emotions and how men process and emotions. So the reason why I mention that is because when we went through COVID, for instance, and we're covering all the faces, the female babies are disproportionately being negatively affected and they are experiencing developmental delays and issues that the male babies are not.
Holy. I would never, ever have thought about that.
Right. Because we're not taught this stuff and we're not aware. If we were aware of that, I believe that our health professionals, especially in the United States who are driving this, like at the CDC and so on, would have potentially made better choices for
the early childhood development phase, especially.
Early and even in adulthood, because women are still relying on facial recognition because that's how our brain works. And now we don't get to see it. So we're losing a whole piece of our cognition.
Oh, that's going to leave a mark for generations to come. But for me right now in the moment, that's a mind blower. And gosh, Kayla, I mean, first of all, I've already got an idea. We have to come back on and we have to dig deeper into the brain because this is thinking fascinating because there's a million questions that are popping off of this. I'm like, stop it. All my hemispheres and all my regions are all connected. Just set them on fire. I really want to come back here. But what I want to also, you have come from, you told your story. You ended up at the CDC 7 years and a handful of days. I mean, you were there. It wasn't like you were there for a quick little thing. This one was embedded, you guys. She knows that world it out. So she's got an authority here. All of your training, now you're a PhD in a very, very interesting field of study, like fascinating. And some of the things you've already shared probably makes people go, what? You even moved from kind of like the biohacker space and in that realm, and even had a site known as the BioCurious, which I thought was really clever. And you're kind of retiring that and moving on to where you are being pushed into more of the research and even more into advising or consulting in the corporate world. So tell us a little bit about what that is looking like now, and maybe what the next, like briefly what the next iteration is, and what's next for you that we all need to be watching out for.
Yeah. So it's really interesting because when I left the corporate world, CDC, I was kind of like, woof, I'm done with that. I'm not going back there because of all the reasons we talked about, of all the limitations that I personally experienced as a woman and how difficult it was on my body. Beyond that, I loved my time at CDC. I got to do some amazing things and do work around the globe that was really important and impactful and all of that. And it was a hard structure to work within as a woman. So when I left that space, I was like, yep, never going to go back there. I'm going fully into entrepreneurship, and I don't care if I have to live in a cardboard box, but I'm never going to go back to that space. Well, lo and behold, that space is like, wait, come back.
We need you.
And I was like, oh, okay, you do need me, I think. So what I'm really excited about is that corporations, not only across the United States, but in Canada, the UK, Australia, I've worked across Europe, they are hungry for solutions to this problem of women leaving the workforce at mass. And they really, really want to understand women so that they can support that half of their population, of their human resources, right? They want just as much as every individual woman, and I think really everyone on the globe, when it comes down to it, wants women to be able to be in an environment where they can succeed, right? Where they can thrive, where they can be healthy, where they can be happy, where they can bring their gifts that they bring as the feminine to these organizations. So with that, corporations who have been privy to my work, and I'm so grateful that it's kind of spreading like wildfire. And I also hope that I'm not the only one out there doing it, because we need so many more people shining light on these problems. They are craving and asking for solutions, and it's coming through the movement of diversity, equity, and inclusion, which everyone's heard those things, right? We are pouring millions and millions and billions of dollars across the globe into this space and finding no real solutions. And corporations are tired of wasting their money and not seeing any results. So what they are now understanding is they have to back up, get some more information, and then they have to really critically look at their structures, their policies, their infrastructures, their culture, and all of the systems that they have within their organization, and then also be able to take that information and be able to restructure to create an environment that's more conducive for all people, no matter what gender or identity or body they have.
And even so of those experiences within just the flow of life.
Yeah. And so I've just been amazed that the world's opening up in this way. And I really thank the COVID experience for opening this door, because that was the eye opener for everyone. And then when women were saying, I'm tired of this, I've gotten some other kind of experience now, and I'm not going to go back to the rigidity and something that doesn't work for me. The corporations were like, wow, okay, we have a problem. And there's a lot of studies that have come out that have shown that women in leadership positions outperform their male counterparts. And I also think it's because, we start the race a little behind, so we work not that we're better positioned to do these things. But what it does show us is that if we create an environment where we can allow women to come into these positions, we are going to have more balance and harmony and success within our corporations, and more healthy corporations and communities that can thrive. And that's really what we all want. And on the same coin, now I am being brought into the government policy space as well within the United States and also Canada. And I'm so excited, beyond thrilled, to see that our politicians are waking up to these issues and also wanting real education, real solutions to create more equitable policies for our globe. And
Wow.
so I'm very, the vision that I dream of is really becoming a reality and possible. And I'm just grateful to be able to play my role wherever that is. And I'm excited to see where humanity goes, because I think we're going in a positive direction.
I have so many goosebumps right now because I am just like, the first time I met you, you blew my socks off. I don't even know, like, the rapid escalation and evolution of your experience and what you can bring to the table to change things. It's mind-boggling, honestly, and I cannot wait to see where the next 5 years is going to take you and all of us. And it's just, I want people to be able to get on someplace to find you, follow you, track you. Let's get you back on here for another conversation. But Dr. Kayla, where can they find you right now?
Thank you. Yes. So some of you may have already been following me under my pseudo name on the socials, which used to be BioCurious Kayla, which was so fun to be able to use that name for so long. And I have transitioned everything over, now finishing up with my PhD in that chapter and starting this new chapter. And so everything is under Dr. Kayla Osterhoff on the socials. And then if you would like to learn more about female biology, the female biological rhythm, get involved with the science, even if you want to donate to this cause to help to close these gender gaps, you can visit herbiorhythm.com.
Amazing. Amazing. And it is a powerful tool. You've got programs for like the layperson, you've got programs for the educators, you've got programs for the clinicians, and even for the policymakers. And so this is what's exciting. You are really trying to touch point into all the areas that need to be impacted to help create the foundation and the environment in which all of us can thrive. And so deeply honored, deeply grateful. Can't wait for our next conversation.
Yes, thank you so much. And I'm so grateful for you and our friendship as well.
Thank you for joining us for this episode of Metabolic Matters. We hope you found today's conversation insightful and empowering. As we wrap up today's episode, we want to take a moment to acknowledge the incredible team and supporters who make this podcast possible. First, we'd like to thank our production team, Alex Sanchez, Cindy Kennedy, Jessica Gilman, and Lynn Hughes, for their hard work behind the scenes. Our theme song was written by Julie Newmark and performed by Whiskey Flower. And finally, we want to thank you, our listeners, for tuning in and being a part of the Metabolic Matters community. Do you want to learn more? Please visit our website, metabolicmatters.org, and you can follow us on Instagram. If you liked this episode, please leave us a review and share it with your friends and family. And if you want to help support our mission, spreading awareness and knowledge about metabolic health, reach out. We'd love you to join with us. Also, don't forget to subscribe to our channel and hit the notification bell to stay updated on upcoming episodes. We have so much exciting content coming your way. Until next time, stay curious, stay empowered, and remember, your metabolic health matters.